So pigment is normally associated with sun damage and sun exposure. In fact, we often call them solar lesions. But pigment can occur for numerous reasons. It can be hormonally stimulated. It can be stimulated by almost any trauma to the skin. We see this more so in the mid-range Fitzpatrick skin types. The Fitzpatrick scale types people according to the density of melanin or pigment in the skin. The paler skin types tend to not develop as irregular patterns, although sun damage can change that. But the mid-range types tend to struggle with pigment that develops because of acne lesions, or even a strong chemical peel can stimulate melanin in the skin. So when those melanocytes, the cells that produce pigment, become excited or stimulated, they will send increasing amounts of pigment to the surface of the skin. And unfortunately, as we age, it tends to spot the skin in irregular ways. So a lot of people will say, I've been out in the sun my whole life, I always tanned and my skin was very even, but now at 30, 40, 50, I'm starting to see little kind of freckle patterns, odd little spots on the face. Now, a lot of that is old pigment that has been almost lying dormant in the skin for a while. We're treating sun damage that maybe occurred years ago. So we have to almost take a multi-systemic approach to treatment. There are some treatments we can render on the skin that are very quick. One of those is dot laser. It can penetrate the skin, sort of lift that melanin up. It gets darker before it finally sloughs off, but we can get some really nice resolution of that. But we often want to do that in conjunction with treatment, and there's a myriad of products available now. One of the most popular ingredients that we use is hydroquinone. It's a very effective tool. It's a centerpiece of the Obagi system. So one of the tools that we use in treating hyperpigmentation is the Obagi system. This is the new derm kit within the Obagi skincare line. And it's very effective in treating pigment mainly because of the presence of an ingredient called hydroquinone. It is a fast, effective skincare lightener, and we often use that to treat patients, but we have many other options. Skin Medica, another product line that we carry, has come out with a skin lightener that is hydroquinone free for patients who don't tolerate that ingredient well. But there are even others. Again, we go back to retinoic acid, which is also an effective treatment for the skin. Not a skin lightener per se, but very helpful when used in conjunction with these pieces. So even though there are some set programs that respond to the need to depigment or lighten the skin and get rid of brown spots and hyperpigmentation, there's also some variation, some customization that needs to take place because not every patient responds to the same regimen. And that's where your skincare professional can be very helpful in putting together a system that works for you.